Hey guys, my name is Olivia Raybone, and I'm going to be talking about nasogastric intubation, enteral feedings, and parenteral feedings. And we're going to be talking about interventions for them, complications, and all that type of stuff. So first, I'm going to start off with the different types of nasogastric intubation. So we have decompression, which is usually to remove gas or stomach contents. So you would usually see that with probably like an intestinal blockage where, you know, what can't go down is probably going to come up. So you just kind of want to help them out with that type of situation. And then we have feeding, which is usually if they have like some stomach blockage or something going on where they can't digest properly. And so the best way to do that is with a nasogastric. And then we have lavage, which is just washing the stomach. And then we have compression. And usually you would see that with applying pressure to prevent hemorrhaging. So the next thing I'm going to do is talk about how to insert a nasogastric tube. So I don't have the proper tools for it, so we're just going to use this shoestring. So I have my lovely assistant here. So the first thing you want to do, which is what you want to do anytime, is, verify name and birthday and check the MAR, wash your hands, all that type of stuff. But really what you need to do is you want to settle first type of communication with your patient. Now, inserting a nasogastric tube is going to be uncomfortable. There's nothing really you can do to prevent that. So you're going to have to warn them about it, but it should not be painful at all. So if they're having any type of pain where it's just like a stabbing pain or something like that, that's just wrong. And so they're going to like put their hand up or something like that. So you just want to establish that type of communication. So, because you don't want this to be painful or all that stuff. You want them to trust you and all that type of stuff. So first thing you're going to do is you're going to put on some gloves and you're going to measure this. So you want to measure it first from the nose here to the tip of the earlobe. And then you're going to take this spot and then you're going to bring it down to probably like mid-chest line under the boobs. It's going to be a little weird, but that's how you're supposed to do it. And you want to measure it with like a Sharpie or something like that. Just so you know how far you're supposed to go, and especially if it gets, it moves while it's in there, and you come back later, and you're gonna see that it's moved somewhere, and you need to adjust that. So after that, if you could face forward, please. We're going to check each nostril and see which one that we're going to put it in, because sometimes people might have a deviated septum, and one is gonna be bigger than the other one. And so you want to pick the best one. And then you're going to want to put lube on it so it goes in there smoother and all that type of stuff. So once you're going to have them lean back their head a little bit. And once you want to put your hand right here, because they're going to be moving a lot and they're going to be trying to resist this, because once again, it is very uncomfortable. And so you want to apply like slight pressure so that they're not moving around a lot, because that's just going to make the whole experience worse. And so once you do insert it and all that type of stuff, once it reaches your throat area, you're going to want to have a glass of water with a straw and have them just start drinking, so that it will just like make the whole process go easier and quicker. And they're going to want to gag. It's just really uncomfortable experience. And you're also going to be doing this by the markings that you have. And so once you get to it where like the end of the marking where you measured it like here, it's at that point you know that it's in there. And after that, you're going to want to secure it with some tape on the nose. And then after that, you're going to check the placement of it. And one of a better way for a nurse to, the priority nurse action to check the placement is to check the gastric contents. And so by doing that, you just have like a litmus paper, and the best way is to have it below 5. If it's above 5, that's just like not in the right place. And so then we know it's in the right area, but then the best way is by an x-ray. And so that's really the most, ensured way that it's in the right place and all that type of stuff. And then thank you for helping me. You're welcome. All right, so now here and talk about the rest of it. So I'm just going to go over a little bit of considerations, outcomes, client education, interventions, and possible complications. So I'm going to start off with interventions. Right when I showed you how to do it, so now I'm just going to walk through it. So before, like I said, you want to identify the client, provide teaching, evaluate understanding, hand hygiene, and set up equipment, and provide privacy. Now during it, you want to make sure that the bed is in semi-Fowler's position. You don't want them to be laying down or like all the way sitting up. It's just a better position and also just more comfortable all around to do that. And so you want to assess nares. You want to make sure it's the correct procedure to insert tube, check placement like we just talked about, but post intervention is to maintain NG tube, measure output, provide comfort. Oral hygiene is key, because while they have like something in their throat and the whole procedure is done and all of that type of stuff, it's still going to be in the back of the throat, and it's just gonna be uncomfortable. And so you want to make them as comfortable as possible by providing oral hygiene. And another thing is to do abdominal assessment, because you want to make sure that they're having bowel sounds and that there's no distension or like hardening of the abdomen, because that would indicate certain complications that are happening that you just don't want that to. So also, let's see. An outcome of nasogastric intubation is it relieves distension or nausea and vomiting. It provides proper nutrition, and it also helps with foreign contents such as blood, alcohol, poison, which are the different kinds as I talked about, like decompression, lavage, compression, and feeding. Let's see, sorry, I lost my train of thought. Oh, you also want to make sure that after it's been placed in there that you come and check on them at regular intervals, because if an occlusion occurs or it's been displaced or anything like that, you're going to want to make sure it's fixed. And you also want to adjust them at regular times too, like lateral recumbent and all different positions. All right, so now I'm going to go to enteral nutrition and a type of nursing management to handle certain complications. So the first one is prevention of aspiration. So to do that, we want to have the head of bed elevated 30 to 45 degrees while feeding, which is going to be semi-Fowler's. And then we're going to make sure that after the feeding, we're going to have them sit for 30 to 60 minutes. Because if they lay down or anything like that after feeding or while feeding, that can lead to aspiration and choking and all of that type of stuff, and that's just not something you want to happen. Now, if they start vomiting or anything like that, you're going to want to withhold feeding, absolutely. Now, next thing I'm going to talk about is prevention of diarrhea. So the best way to prevent diarrhea while feeding is to not dilute the formula with water. You don't want to do that. That's just going to irritate the stomach and gastric content. And then you want to also make sure the formula is not contaminated, just like we wouldn't want to have our own food contaminated and create food poisoning and all that type of stuff. But if diarrhea does occur, you want to slow down the formula. Now, for maintenance of tube patency, you're going to want to irrigate with water before and after each feeding, and before and after drug administration. And you don't want the water to be too hot or too cold, especially if it's room temperature. I mean, I don't know how that would feel to have just like cold or hot water just going directly into your stomach. So, and you're also going to want to make sure that you do regular residual checks with 30 to 60 milliliters of water. And also, when you're doing gastric content checks, you're going to want to put back the gastric contents as well. We don't want to take that away. Unless it's like decompressing or something like that, then you're going to want to help with that kind of obstruction. And you also want to have continuous feedings administered on feeding pump with occlusion alarm. To have the alarm on, you just want to make sure that they're not going through any issues or all that type of stuff, because I mean, this is all about priority of patient safety. Now, checking the tube placement. You're going to check tube positioning often by the markers placed upon insertion, which I demonstrated at the beginning of the video on measuring where you're supposed to have it, like from your nose to here and then also here to here. So by having that marked and you come back later and you see like the Sharpie mark all the way down here, you know that's not where it's supposed to be. So, and then once again, check residuals every 4 to 6 hours. Now, administration of medication, like I've already sort of highlighted before, you're going to want to irrigate with water before and after administration. And if more than one medication is given, flush in between each medication. You do not want to give like all the medications at once. And I want to make sure this is very talked about is you do not want to crush enteric-coated and long-acting medications. That just defeats the whole course of action the medications are supposed to be doing. Now I'm going to be going into parental nutrition, which is when it goes into like kind of like an IV form of parental nutrition. So the first complication that you want to, like for nursing management to prevent is infection. So you're going to want to have a filter when you're doing all of this, especially with lipids, amino acids, and dextrose. And to prevent that, or the type of interventions that you're going to want to do, is to change the bag, tubing, and filter every 24 hours, especially with lipids. Now with amino acids and dextrose, you're going to want to change the bag and filter every 24 hours, like the lipid intervention, but the tubing is going to be every 72 hours. You're also going to want to apply sterile procedure to this when changing central line dressings, because with parental, it's going to be with a central and a PICC line, or a PICC line. And so you want to apply sterile procedure absolutely to help with infection and all of that type of stuff, or to prevent infection, of course. And also another thing that, I mean, is not just applied with parental nutrition, but any type of situation that you're in the hospital, is to monitor for signs and symptoms, and to monitor vital signs every 4 to 8 hours. So you want to quickly recognize the signs of a systemic infection or a localized infection as well. Just make sure nothing's going on. And you're also going to want to assess the site as well for edema, redness, tenderness, all that type of stuff. And if there is an infection, the best thing to do is to send a culture and of site and notify healthcare provider for the next course of action. Now the next thing that we're going to have some issues with is hyper and hypoglycemia, which, if you know anything about diabetes, that's just going to not be, diabetes is just an issue for types of infection, or any type of infection. It's just going to make it worse. So with hyperglycemia, you're going to want to check daily labs and prior to any type of new bag administration. And you also want to check blood glucose throughout the day, every 4 to 6 hours. And monitor for signs and symptoms of hyperglycemia as well. I mean, hot and dry, sugar high. I mean, that's just one way to remember it. Another thing to do is, with parental nutrition, we can accept a higher glucose range. So, I mean, around 140 to 180 is still normal. It's nothing to get freaked out about, because, I mean, this is a type of nutritional feeding. So, I mean, they can handle a certain amount. And so you want to have them on a sliding scale just to create a normal glucose range for them. Now, for hypoglycemia, which is a very dangerous position to be in if you're having that type of issue while you have with diabetes. The best prevention to do is have 10% dextrose and water at bedside in case feeding solution runs out and next bag not available. So whenever you're in these type of situations, you just want to always plan ahead to make sure that the worst case scenario that you are prepared. And just like with hyperglycemia, you're gonna wanna check blood glucose and monitor for signs and symptoms of hypoglycemia. So cold and clammy, need some candy, is just another helpful way to remember the signs and symptoms of hypoglycemia. Now on to patient safety with parental nutrition. Let's see. All right, lost my train of thought. Whenever you administer a nutrition bag or anything like that, you're gonna wanna look over tubing and look over the sites that you're gonna do and check solution for leaks and color change and clarity and fat emulations breaking, just to make sure that no future complications are going to happen. And then you're also gonna wanna make sure that the bag and tubing change is going to be changed every 24 hours, just like with the lipids on infection prevention and amino acids and dextrose. You want to change the bag and filter every 24 hours, tubing every 72 hours. Those are just basic things to maintain patient safety and comfort. The last thing that I'm going to be covering is maintaining PN solutions, parental nutrition. So with this, you're going to follow a septic technique to reduce infection. And just like I said before, change filters and tubes every 24 hours. And you're gonna always do this for most of the things that you're gonna be doing, like with an IV site or catheter, but especially with this as well, you're gonna wanna label the bag, date and time of administration. You're also going to make sure that there's no blood from the line, because with parental nutrition, it's going in a central and PICC line. So you don't want blood to get up in there and just create more complications. Now you're also going to make sure that you are not using gravity to do the pumping system. You're going to want to use a pump system. And you also want to make sure you set alarm for obstruction. And make sure to check infusion settings periodically to maintain correct infusion. So these are all just things to make sure the patient is safe and not having any type of serious reaction that can occur with enteral and parental and nasogastric nutrition. So that's all I have to say. Thank you.